Good day, ma'am. My name is Lady Diane Guardario, and I will be demonstrating about wound care. So first, check the medical record for dressing of the patient. And then, explain the procedure to the patient and instruct him or her not to touch his wound and also the sterile materials. Good morning, ma'am. Ako di ay si Lady Diane Guardario, ang imong nursing assistant for today. So karon akong himuon is wound care akong ikon imong samad. Okay ra ba ninyo, ma'am? So pero before ana, ma'am, dili para nimo ayaw jud og hilabti ang imong samad ug kaning mga gamit diri sterile ha. Okay, ma'am. Salamat. Nakanganga ko. After explaining the procedure to the patient, we must gather all the equipment needed. So, I have here the waste receptacle, the antiseptic wound solution, the antiseptic ointment, the kidney basin, the sterile forceps, the sterile swabs, the tape, the sterile gauze pad, the blanket, the face mask, and the sterile gloves. After explaining the procedure and securing all the materials needed, we need to have the patient a privacy. Now I will be going to position the patient comfortably and drape her using a bath towel to expose his wound area. So once the patient is comfortable, place the waste receptacle. Then wear your face mask. And then wash your hands or sanitize your hand. Remove the old dressing of the patient's wound, and then before removing the dressing of the patient, apply gloves. So after wearing the gloves, first thing to do is remove the tape slowly. And then carefully remove the gauze one layer at a time. And put it in the waste receptacle. There are things to remember, just like if a wet to dry dressing becomes uh, stuck, do not moisten it. Instead, gently loose the dressing and warn the patient of potential discomfort. After that, I'm going to examine the amount, type, appearance of the drainage on the dressing as well as the appearance of the patient's wound. And then remove the gloves and put it in the waste receptacle. Prepare your sterile supply and proceed apply dressing. So we have two ways in applying dressing from um, dry and wet dressing. Now I'm going to demonstrate about the dry dressing. So for dry dressing, the first thing to do is open the sterile supply. Mas GMA, gani, manager sa at battalion.
Yung ano nga pina-judge man siya diri sa contest aning sa mura siya asak gani kung sa ABCDN ko lang gani. Makatawa ka ayo nga di ba ta siya senior di ba? Sige na.
Um, natin.
Ay, uy kana. Kanang tray butang sa diri. Butang diri. Na kuha aning pagbutang ni mo diri sa tray, kuha aning gloves din diha ka mag-apply.
Open the drape carefully and then wear your gloves. After wearing the gloves, next thing to do is pour a bottle of antiseptic solution into the kidney basin. O kani nga situation kay kinahanglan og assistant. But today wala man ko'y assistant so ako nalay maghimo sa akong kaugalingon. After that, I'm gonna inspect the patient's wound and uh, appearance, the type, the discoloration, and the drains and drainage. It is important to avoid contact with other contaminated materials. So, tan-awon na to ang iyahang samad if unsa siya kalala or dili balala. Okay, lalom-lalom siya. Now, I'm gonna dry the wound using a dry swab. After drying the wound, I'm not gonna cover it with loose gauze. I'm gonna use this pre-cut gauze 4x4 size as a contact layer of the wound. Now I'm going to proceed with the wet to dry dressing. So for the wet dressing, I'm going to pour the prescribed solution on the kidney basin. Then, but this is the time that I'm going to add a fine gauze. Now, I'm going to cleanse the wound, same technique as before using the swab. After that, you don't need to dry the wound. Instead, apply moist fine gauze as a single layer directly into the wound surface. So ato ni siyang pig-un kay dili pwede ang basa kaayo. And then after that, apply sterile 4x4 gauze over the wet fine gauze and apply it directly. After that, remove your gloves and dispose all the equipment that you after that remove your gloves and also the face mask and then dispose all the equipment that you use. And then wash your hands. That's all. Thank you.